Benzodiazepines are a class of drug often prescribed for anxiety and panic. They're also prescribed for a host of non-psychiatric conditions like muscle spasms, tinnitus, and seizures. Benzodiazepines, or benzos as they are sometimes called, are tranquilizers and sedative hypnotics in the same class as Valium. Some common names of other benzodiazepines include Xanax, Klonopin, Ativan, Librium, and Restoril. These drugs all work to depress the central nervous system. Manufacturers' guidelines for these drugs recommend they be prescribed for 2 to 4 weeks of successive use, but no longer. Medical providers are and have been for a very long time ignoring these guidelines and prescribing benzodiazepines long-term without warning patients or giving them informed consent about the risks of taking benzodiazepines for more than 2 to 4 weeks. When people take benzodiazepines as prescribed past the recommended 2 to 4 week period, they become physiologically or physically dependent on them. We are talking about people who are taking the drugs exactly as their doctors advise them to. When a person on benzodiazepines becomes physically dependent, their body and brain actually change and become adapted to the continued presence of the drug. This causes a myriad of problems. One of them is tolerance withdrawal. Tolerance withdrawal is when the drugs no longer work at the prescribed dose and withdrawal symptoms start to emerge while the patient is still taking the drug. Often, the emerging symptoms in tolerance are misdiagnosed as other medical conditions or psychiatric disorders, and patients are drugged further with more psychotropic drugs. Once dependent, people discover they cannot stop taking the benzodiazepines without severe and disabling withdrawal symptoms. This, then, requires a long, tedious, and painful process of tapering off the drugs, which can take many months or years to complete. Worse yet, because benzodiazepines are controlled substances, some patients are being refused the opportunity to taper themselves slowly off of the drugs, which is the medically recommended way to discontinue them safely. Instead, they are being treated to cold turkey the benzodiazepines after being cut off by their prescriber. Risks of cold turkeying these drugs are serious. People report suffering hundreds of uncomfortable symptoms. These can include psychosis, seizures, and severe protracted withdrawal, which can persist for years. Sometimes the cold turkey withdrawals are so severe that people actually commit suicide because they cannot endure the seemingly never-ending suffering. Irresponsible prescription of these drugs and subsequent maiming of unsuspecting people taking them has been allowed to persist since the 1960s in spite of numerous reports, campaigns, and warnings, and medical journals detailing this problem. Unfortunately, there has been total apathy on the part of global governments to do anything about this problem. Subsequently, victims of irresponsible prescription practice are left alone without support. When people are disabled in this way, they often cannot find the services or help that they need to find their way through. Oftentimes, they lose everything: their health, their jobs, their income, their social lives, even their families in the process. WBAD is a grassroots movement created to bring awareness to and education around this issue and to hopefully elicit the much needed change that is long overdue. Thank you for joining us on our website, and learn more to get involved.